I'm going to die, just as you are. I'm going to leave my family and friends, with or without ceremony. Maybe it's going to be after a long illness or from a tragic car accident. But before I go, I will likely see medical personnel or have a hospital stay. Knowing that we're going to die means that we have the opportunity and the obligation to make our wishes known as to how we should like to be cared for at our end. In 2010, Midwest Care Alliance, or MCA as I shall refer to them, wrote the booklet Living Well at the End of Life. In it, they point out that today, advances in medicine and medical technology save many lives. Often those lives wouldn't have been saved 60 years ago. Sometimes this technology also artificially prolongs lives that have no reasonable hope of recovery. I work in a large hospital on a unit whose patient population are generally those with long-standing or chronic illness. I watch these patients teeter on the edge of illness and death, and I support families who have difficulty making decisions for patients who have left no clear instruction as to the type of medical intervention and treatment they should prefer to receive. Advance directives are an essential part of ensuring that your wishes and beliefs are honored when you are unable to speak for yourself because of illness or tragedy. I would like to highlight the type of documents that you should have and speak to your loved ones about. I would like to discuss the name and meaning of each one of these type of important documents. Advance directives include a living will, a durable power of attorney for healthcare or DPOA, a DNR or do not resuscitate order, an organ donation designation, and a letter of instruction. MCA defines a living will as a legal document that allows you to establish the type of medical care that you would receive if you were to become permanently unconscious or terminally ill and unable to tell your family and physician what type of treatment you would like to receive. A DNR may be signed by your physician if you become terminal and permits you to die naturally without postponing your death, would only offer you comfort care measures such as pain medication, and would not include CPR if your heart or breathing ceases. A DPOA, according to MCA, designates an individual of your choosing to authorize and refuse medical treatment for you, but unlike a living will, it is not limited to a situation in which you are permanently unconscious or terminal. MCA also suggests that you go to your Bureau of Motor Vehicles to decide whether you should like to be a donor or a non-donor for organ and tissue transplantation. In 2010, online magazine ARP also suggested that you include a letter of instruction. This letter of instruction can be very personalized and include contact phone numbers, insurance policy information, financial information, can also be for gifting and for special messages to loved ones. It can be overwhelming trying to make these medical decisions and advance directives. So if you enlist the help of an attorney, that's good. Or if not, you can use online sources to file these papers for free. No matter which way you decide to go, you will be saving your family much heartache by being proactive about putting in place your wishes and your advance directives. In a 2005 American Family Physician Journal article, Doctors Crane, Wittick, and Dukas say that predicting preferences at the end of life is complicated by emotions of the patients and their families, especially considering the complex nature of illness and the medical capability to sustain life. ARP adds that although starting the conversation might be awkward or difficult, sharing your concern with your loved ones and communicating your beliefs and values can help set the right tone for the dialogue. MCA also published a booklet in 2010 titled Conversations That Light the Way. In it, they ask specific questions regarding your beliefs and medical care that will help you tailor or individualize your living will to suit your needs. There is much peace in knowing that you have shared your wishes and your beliefs with your family and loved ones. Getting started for executing advance directives may be a big jump, but keep it simple. DeMasters suggests that you should start small with a basic form that you individualize, knowing that it needs to keep evolving to keep it fresh. Crane, Dukas, and Wittick go farther by saying that you must keep it current and in line with your current values, beliefs, and medical conditions. ARP reminds us to share our advance directives with our physician, our hospital, and to make sure that our family knows where these papers are so that they can find them easily without confusion and added stress in an already stressful time. I hope that you now understand advance directives and the meaning and their utter importance in making your wishes known. To ensure your beliefs and your wishes are honored when illness or tragedy make you unable to speak for yourself, advance directives are essential. For more information about advance directives, the booklets that I've talked about, or current forms for filing these forms in the state of Ohio, please visit MidwestCareAlliance.com. And this is my 2 note cards, 1 and 2, and I did use a bit of the back on this one. Okay.